Community Connections, your bridge to resources. My name is Krista Mostowski and I'm with Community Hospice, and I'd like to welcome you to today's webinar on planning for Medicare open enrollment. Medicare open enrollment, I believe, begins tomorrow, so it's prime time that we have Ms. Sandy Howell with our local HICAP office here to give us all the most relevant information that we need to make the best decisions for ourselves when it comes to our benefits. So at this time, I would like to welcome Ms. Sandy Howell to present today. We will be presenting for a short period of time here, and then we'll open it up to questions and answers to our participants. So if you have any questions throughout this presentation, I encourage you to please provide those or leave those questions in the chat box, and I will address them for you, ask them to Sandy at the end of the presentation, and get the answers that you need. If you have any questions at all after this presentation, you can visit our website at hospiceheart.org to review the video, as well as look at the resources that Sandy is leaving us to provide, or you can contact our local HICAP office and she'll provide that information to you. So at this time, I'd like to hand it over to Ms. Sandy Howell. Sandy, thank you for being with us here today, and thank you for sharing this information. Sandy, we can't hear you. Sorry for the technical difficulty. Give us just one moment as we figure this out. Sandy, can you hear me? I can't hear you. You want to check the microphone? Just one moment, thank you.
Okay, I'm trying test.
Can you hear me now, Kristen? Okay, great. Okay, thank you so much, Kristen. I think there probably wasn't inadvertently a button pushed that didn't need to be pushed, but thank you so much for inviting us here. Yeah, my name is Sandy Howell, and I am a HICAP counselor, and HICAP stands for Health Insurance Counseling Advocacy Programs. So myself, along with several other counselors, are available to assist and help people that have Medicare. And I will explain where the office is and how you can reach us. And I have some slides today I want to share with you. And the important thing is, like Kristen said, that open enrollment starts tomorrow and it goes from October 15th to December 7th. And see if we have the slides. And I think I might have another technical difficulty, Kristen. I pushed the button for the slides.
Sandy, go ahead and just click on your screen and then try your slides.
With the mouse.
Okay.
Anywhere on your screen.
Okay, now press the arrow.
Oh, magic. Thank you very much. Yes. So again, October 15th through December 7th. And that is when there is open enrollment, when people that have Medicare can change from one Medicare Advantage to another, or change your prescription drug plan. So this is what is called the annual period from October 15th to December 7th. So if you have original Medicare with supplemental drug coverage or Medicare Advantage, like I said, you may make changes if you want to do so. And the changes will go into effect January 1, 2021. So the annual open enrollment period does not apply to Medigap or supplemental plans. So if you have Medicare and a supplemental plan, which are only guaranteed to issue the initial enrollment period and during limited special enrollment periods. Although some companies may offer enrollment into Medigap at any time. And that would probably be, during some specific election periods. So remember that Medicare alone isn't enough. Original Medicare pays 80% of what it allows. So there are deductibles that apply. And your Part A, and I'm just reading this up here for you, is Part A is free to most. Part B, there's a premium, which we don't know what 2021 will be. And Part D covers prescription drugs. Most Medicare Advantage plans include prescription drug coverage. If your prescription plan is a standalone, the premium can vary. And there is extra help for people that may need assistance. So just to explain this slide a little bit, on the left column, the Medicare Advantage plans, when we compare it to Medigap supplemental plans and to private insurance. And if you have private insurance or employer coverage, that's great. You might want to have a Medicare Advantage plan or a Medicare supplemental plan, and here's the difference. When you are a member of a Medicare Advantage plan, your premiums may be a little bit lower, from 0 to 135. It covers deductibles, there's reduced hospital costs, and it includes prescription drug plan, and there are some out-of-pocket costs and some additional benefits too, but you must use that network of physicians. Medicare supplements or Medigap is when they pay most that Medicare doesn't cover as secondary insurance. So there's generally higher premiums. It covers most deductibles and copayments, and it allows you the freedom to choose your physician and hospital. You are not part of a network, but it doesn't include a prescription drug plan, which means you will need to get a separate drug plan. And there is help for assistance based on your income too, and veterans may also qualify for care through the VA system. So what I want to talk about today is the plans that are available in Stanislaus County. If you are on this program right now and you are in another county, say Merced or San Joaquin or Tuolumne County, you will have to check with a HICAP office in that particular county to find out what plans are available. So these are Stanislaus County plans, and there are 10 Medicare Advantage companies that are in Stanislaus County that offer 18 different plans. I went back too far. We have these in alphabetical order: AARP, Secure Horizons; Alignment, Anthem Blue Cross, which was CareMore; Blue Shield Promise, Golden State, HealthNet, Humana. There is a new plan called Imperial Health Plan. There's Kaiser, and there's Scan Health. So those are the 10 Medicare Advantage plans that are in this county. So what we have that we offer at the HICAP office is a comparison sheet. One of the things I want to mention at HICAP is we are unbiased. We do not recommend, if you were to ask me what plan would be best for you, I would only provide you with that information, and you are able to make that decision. So this is our comparison sheet for 2021 that I will go over with you in just a moment. Here's how this helps how you can compare the plans. The question we will ask you as a HICAP counselor is, what is the most important thing for you? Is it keeping your doctor? Which hospital would you go to? What is the cost if you need an ambulance and you're hospitalized? Or are you actually looking for the extra benefits like transportation, dental, vision, and possibly hearing? Those are important things. So here's how we read that. On the left column, we have the HICAP phone number and address, and it just states the benefits: the monthly premium, hospital coverage, physician specialist, outpatient hospital, emergency ambulance, durable medical equipment, lab and x-rays, prescription drugs, skilled nursing, transportation, then dental, vision, and hearing. And at the bottom, we have what the maximum out-of-pocket you would pay on copays, which does not include your premium or prescription copays. So the second column is what original Medicare covers on that benefit. So actually, where it says monthly premium, there is Part B. We do not know what the Part B premium will be for next year. Now, in the hospital coverage, we also don't know what that deductible will be for next year. Physicians, now, if you have Medicare by itself, this is what Medicare would cover. It would pay 80% of what it allows, and you would have to pay the other 20%. So again, you have a choice between a Medicare Advantage plan or a supplement. So what also happens is with this comparison sheet, these are the comparisons for Medicare Advantage plans. What we did is we listed them alphabetically. So if you look across the line, there's the premium, actually the name of the company, the phone number to reach them, the hospital that they contract with, and the network providers of doctors. Then they have the name of the plan across the top, the monthly premium. As you can see, some have premiums and some are zero. Then you have your copay for when you're admitted to the hospital. So there are some plans where there's a zero copay. Some is a certain amount for a number of days. It could be from 1 to 4 days, 1 to 8 days, and some you just pay a copay when you're admitted. So the next line is physicians and specialists. You pay a zero copay or maybe $5 to $10, and then the amount below that is what you would pay when you see a specialist. Now, outpatient hospital, that means if they're doing a procedure and they're as an outpatient, or if you're going to go to the surgery center, there would be that copay. Now, emergency ambulance. In some cases, there's a copay for the ambulance, but if you're admitted, and that's what the little asterisk would mean by the amount, if you're admitted to the hospital, then that copay is waived. If you're treated at the emergency room and released, then there is a copay for that. Also, and the next line is durable medical equipment. And as an example, that would be a wheelchair, walker, oxygen. Those are some examples of durable medical equipment where the plans, there's a different copay. Some would be just a straight 20% copay, or depending on the particular durable medical equipment item, you might have a different amount. There's also the next column is lab, x-rays, tests. So there's usually just for regular x-rays, there's a zero copay in most plans. But then if you're going to have an MRI or a CAT scan, there may be a higher copay. Now next is prescription drugs. So we have just put in there 3 tiers. There are more tiers with the plans. So we've just basically put in tier 1, tier 2, and tier 3, and those are the copays. And normally, or most often, tier 1 is preferred generic. Tier 2 and 3 may be generic or their preferred brand. And then if you've got tier 4, 5, and 6, that would be a little higher copay if it's a particular brand medication. So we didn't, in the interest of space on our sheet, we didn't put in all those tiers and all those copays. So it's very important. And one of the critical things that I want to talk to you about in a few moments is about the prescription drugs. And that is an important thing if you want coverage for your medication, that you are on the right plan. Skilled nursing and rehab. Usually there's no copay for the first 1 to 20 days, and that can change per plan. And then you are limited to up to 100 days, and that is a Medicare benefit, up to 100 days. So now transportation, there are some plans that cover transportation and some do not. Some have specific requirements that they only cover so many trips or a one-way trip. And one of the things that's important, especially like with dental and vision and hearing, is to be able to contact the plan to ask them more specifics on that. What I want to tell you is, as a HICAP counselor, we actually don't sell anything. So we recommend that you talk to a broker or the plan representative to get the specifics on the transportation and the dental and vision and hearing, because those are things that Medicare does not cover. So those are our additional benefits. So here's how you learn more about Medicare. And I am just going to assume that everyone received their Medicare NU handbook this year. You can see this. And I always recommend that people, when they want to go through their Medicare NU handbook, is to look up a subject, say like skilled nursing, and you want to know what is covered on Medicare and what your plan covers. So to describe skilled nursing, you would look up that section, or you would want to understand what Part A covers, and you would just look up that section. To actually sit down and read through the book, which is a good book, it takes a little while, and it is offered in different languages for the people that would need to see it in different languages. So that's very important. Some of you also may be getting this card in the mail, and it's a card from the HICAP office. So here's what I want to talk to you about, is that the whole local HICAP office is on Coffee Road. It's 3500 Coffee Road, and here's where you can reach us. The phone number is 209-558-4540. Which is also exciting now for those of you who have a computer, is you can look online at www.agingservices.info. We are posting actually more webinars on that site about the comparison sheet, about HICAP, about Medicare Part A and B, and additional services. One of the things with the HICAP office is it is a free service, and we're with the county, Stanislaus County Aging and Veteran Services. So our location is at Coffee Road. The office is open Monday through Friday from 8 to 4:30. The unique thing, if you're familiar with HICAP, is each year we've had forums where we meet at the senior centers. And due to the COVID virus, we were not able to do that this year. What happened is now we're doing like they're doing in a lot of situations, especially the schools, where we're going online like this, where you can get that information. We are seeing clients at the HICAP office face-to-face. You call at 209-558-4540. You make an appointment with a HICAP counselor. There is Carol and Peggy and Al and David and Jim, and they would be happy to meet with you face-to-face to answer your questions, since we're not out in the community at the senior centers like we have been in the past. So that's important, helpful information for you. So for those of you who are in another county, this is a HICAP brochure that will be shown on our website. And if you're in another county, if you call 1-800-434-0222, that will direct you to the county that you reside in for your HICAP office. And this is our HICAP brochure that we make available for everyone. And it lists the services that we offer for you. So it's really important that if you have Medicare or your loved one has Medicare, that we can assist and help them and provide information. So when someone wants to change a plan from their Medicare Advantage plan to another plan, the important thing to do is to have the information so you can make an informed choice which plan is going to work best for you. And that's very important. And again, the services at the HICAP office are free. So also, there's a Center for Medicaid Services that you can get online at www.medicare.gov. And here's the phone number. It's an 800-Medicare, which is 633-4227, if you want to call Medicare directly. Also, Medicare Advantage Plan representatives are available, and there's also insurance brokers that will help you purchase Medigap plans. If you need a list of brokers that are able to assist you with Medicare Advantage, Medicare Advantage plans, but also Medicare supplemental plans, we have a list at the office. If you call, we will be happy to mail one to you. So I know that this comparison sheet that we've put together looks kind of daunting, but hopefully with the explanation that I've given to you, it makes it a little bit easier to look at it. It actually is on both sides. So it is very intense sometimes to get this information, and we are happy to provide this for people. So HICAP is an unbiased office. We do not recommend any plans to you, but we are available to answer your questions. So we are the best source for unbiased Medicare information. And just remember, as I said, that HICAP doesn't sell insurance. We teach you about Medicare and explain your options so you can make informed decisions. which is very important for your health care. So for personalized individual help, call our office, Stanislaus County HICAP, 3500 Coffee Road, Suite 19, Modesto, 95355. We're actually in the shopping center with Marie Callender's and the Veteran Services Office. So the number is 209-558-4540 for face-to-face appointments. We're more than happy to, again, from 8 to 4:30. So I want to thank you, and I think Kristen and I were going to open this up for questions if you have some questions.
Thank you, Sandy. So there were a couple of questions, and I think I may have gotten the answer, but I'm going to let you elaborate a little bit.
Okay.
One of them was from somebody that lives in San Joaquin County, and so they said, will your comparison charts still apply, or will it be different where I live?
Well, the answer to that question is it will be different where you live. And the important thing is that you call the HICAP office. And again, that number, if you are in a different county other than Stanislaus, is the 1-800-434-0222. And it's on the front of the HICAP brochure, the 800 number. So the comparison sheet that I went over today is for Stanislaus County. But they do have Medicare Advantage plans in San Joaquin County.
Wonderful. So I'm going to take that information and I'm going to stick that in the chat field here so that our participant has that contact information as they don't have a brochure in front of them. Are there any additional questions from anyone? We'd like to open it up at this time. Just a reminder that the comparison chart that Sandy presented on today is available, and that's available for you to download at the agingservices.info. That's agingservices.info website, and it can be found under the Medicare Help field under HICAP. It looks like I have one additional question. It says, this was very, very helpful. I'm 63, so not yet eligible, but is it too early to choose my plan?
Well, actually, the quick answer to that would be yes, you are 63. So these plans that I presented to you today for 2021, they have contracts with Medicare that that can be changed each year. What may change might be the copays or the premium. So again, we have a new plan coming into this county, Imperial Health Plan for 2021, which we didn't have. So at 63, you've got 2 more years before you get your Medicare card, unless you're still working. And then when you have your Medicare card and want to choose a plan, that will be the time to come and see us at the HICAP office, a counselor, so we can go over what's available 2 years from now. Okay, hopefully I answered that question for you, but it's very important to actually start getting as much information because Medicare can be very confusing. So educating yourself now is very wise.
Thank you, Sandy. And the participant says thank you as well. An additional question, can you better explain the cost for hospital stays for different plans?
Okay, can I better explain the hospital copay for the different plans? Okay. Yes, the plans, the best way to explain it, and I'm going to show you the sheet, so it can be a little daunting to have you look at it this way without having it exactly right in front of you. So the hospital coverage on the plans can be different. And they have a contract, all these plans have a contract with Medicare, which is CMS, which is called Centers for Medicare and Medicaid Services. So they actually submit what they want their benefits for the year. And occasionally they can change them from year to year, which they do, or they may remain the same. So in the hospital benefit, on some of the plans, it's a $0 copay with unlimited days. On some of the plans, there's a $200 copay per stay. On some of the plans, it's $175 or $75 or $100 for days 1 through 5. So if you're in the hospital for 5 days, you know exactly how much you're going to be spending. And that is a different benefit. For some people, the hospital copay is very critical depending on their income and if they're able to, to cover that. And So the copays, again, are different from the plans. So I'm looking at the front sheet, and again, having 10 plans, we have it on the back sheet too. So the hospital copay on the back, on some of the plans, it's $100 for 1 through 5 days, and sometimes $160 for 1 through 7 days.
Perfect.
And again, you do the math. If you're in the hospital for 7 days, you'll know how much you'll pay. And I really don't have a calculator, and math isn't my biggest subject. So I'm not able to give you, how many 7 days. If you were in for 6 days and it's $100 each day, it's going to be, $600. But if you're in for 3 days and it's $100 a day, it's $300. So hopefully that kind of answers your question about your hospital coverage copays.
Thank you, Sandy. I have another question in regards to the plan, and I think maybe it would be helpful. Could you go move the slides back so that they can see the chart that you're sharing? That might help. That was a request as well. So the next question is, please talk to us a little bit more about the Medicare Advantage plan option for those on dialysis.
Okay, good question. One of the things for Medicare Advantage plans that have been around since, I would say in this area since the early 1990s, one of the things with ESRD, end-stage renal disease, it was a requirement that if that's what you had, you were on dialysis, you could not enroll in one of these plans. If you were on the plan and then were diagnosed with ESRD, end-stage renal disease, and you were on the plan, it would be covered. So you could not switch from one plan to another once you were on dialysis. So there is a new rule starting in 2021. CMS has come out with that these plans will now be covering end-stage renal disease or dialysis. And my understanding is that each of the plans will be available to, not the correct word. Each of the plans will be covering that benefit, end-stage renal disease. So if you're on dialysis, you can now switch from one plan to another. We don't have the copays on all that, on that particular benefit. Okay, what I would recommend is if you were looking at a particular plan, what you want to do is make sure you call the plan and ask them what their copay would be for end-stage renal disease, which would now be covered January 1, 2021. And again, it's important to make sure that you keep your doctors if you want to stay with your doctor, and that the network your doctor belongs to, that you're able to continue with your medical care without having to change your doctors. So that can be very critical for people. Okay. Did that answer your question?
Yes, it did. Thank you.
Great.
Are there any additional questions from our participants today? Just wait a moment.
I do have something else that we're working on. We have another sheet that we're currently working on right now. It's called a special need plan. And there are several plans on that for people who might have been diagnosed with lung disease, heart disease, or diabetes. And then there are other plans for, people that their income might be a little bit lower and it's really hard to get some of those costs. And we call those Medicare, Medi-Cal plans. So it's important to call the HICAP office so we can provide that information to you.
Perfect. Well, Sandy, I don't see any additional questions at this time, but Community Hospice would like to thank you for coming and sharing this valuable information and resources. This is vital for anyone that's applying for Medicare or has Medicare insurance. So thank you for taking the time to share with us today. And we are Facebook Live, so for those that are participating today, if you'd like to share this with your friends and family, we would love to have you do so. Or you could also visit our website at hospiceheart.org, and it is recorded there as well for participants to view after the actual webinar. Again, I'd like to encourage you all to visit the HICAP website. So if you go to www.agingservices.info, this comparison chart can be downloaded there and found under the Medicare Help field under HiCap. So please utilize this resource. It's a great tool. I know you guys have been working very hard on it, and we really appreciate you doing that for our community members. So at this time, there's no other questions. So lots of comments thanking you for coming today and sharing, and we do appreciate it very much. Thank you very much for joining us, and we hope to see you guys soon.
Well, thank you, Kristen. Thank you so much.
Bye-bye.